It's that time of year again. Your mailbox is flooding with colorful flyers. Your TV is filled with commercials promising better, cheaper, more benefits from Medicare plans. It's the Medicare Open Enrollment period, a golden opportunity to optimize your coverage, or a potential minefield leading to a hasty decision you'll regret all next year. For many of my patients, this is the most stressful time of the year, and Mrs. Miller's story is a powerful reminder of why ignoring it can be a costly mistake. Hello, I am Dr. Mariz, and welcome to the Modern Senior. Medicare Open Enrollment, running from October 15th to December 7th each year. This is your main chance to switch between Medicare Advantage plans or change your Part D prescription drug coverage. But the complexity and the advertising pressure can lead to errors. Today, we'll learn from Mrs. Miller's experience to help you make a wise choice. Mrs. Miller had been on the same Medicare Advantage plan for 3 years and was reasonably happy. She thought, it's fine, no need to change anything. So last year, she skipped open enrollment and let her plan auto-renew. But she didn't realize her insurance company had changed its drug formulary for the current year. A medication she relied on for her rheumatoid arthritis was suddenly no longer a preferred drug, her monthly cost for that one medication jumped from $50 to nearly $400. She called me in a panic. "Doctor, I can't afford this." But because she had missed the open enrollment window, she was stuck with that plan and the high drug cost until the following year. The comfort of staying put came with a hefty price tag. Mrs. Miller's story highlights a critical truth. Medicare Advantage and Part D plans can change every single year. Costs, premiums, deductibles, and copays can increase. Networks, your trusted doctor or preferred hospital might leave the network. Formularies, the list of covered drugs can change. Your medication might be dropped or moved to a higher cost tier. Doing nothing and letting your plan auto-renew can be a serious financial and health gamble. So what should you do during this important period? Here's my simple checklist. Read your annual notice of change. Your current plan must mail this to you by the end of September. Don't toss it. Read it carefully to see if your costs, benefits, network, or formulary are changing. List your drugs and doctors. Write down all the medications you currently take and all the doctors you want to continue seeing. Use Medicare's Plan Finder tool. Go to Medicare.gov and use the official Medicare Plan Finder. Enter your zip code and your drug list. This tool compares all available plans in your area and estimates your total annual costs, premiums, plus drug costs. Don't be afraid to ask for help. Talk to an independent, licensed insurance agent or contact your state health insurance assistance program SHIP. They offer free, unbiased counseling. Open enrollment isn't a burden. It is an opportunity to ensure you have the best coverage for your needs and budget for the upcoming year. Don't make Mrs. Miller's mistake. Take the time to review your options. A few hours of research now could save you thousands of dollars and a lot of worry later. Here at the Modern Senior, we help you navigate critical health decisions. If this guide was helpful, please click subscribe so you don't miss our next piece of advice. I am Dr. Mariz. Choose wisely and stay healthy.